people to come and explore what we have in terms of training. All the postgraduate medical education that we are doing is all going towards scholarships. And at the same time, we have now started getting some of those residents, sending them out to become super specialists. And quite a number of them have gone outside, some are in Muhimbili, all on our course to make sure that we provide that level of technology, that level of capacity and technology that Tanzania now needs. We are still lacking behind. There's a lot more that we can do. So, to your question, yes, that's the direction. Everything starts with prevention, prevention, prevention. We need to go down to the community, and to do that, we'll continue to expand our base of primary care. Thank you.
Thank you, Sisao. Now, there's a lady on the backside. Yeah. We have a few minutes before we come to the end of this program. Karibu.
Okay, morning. Regina Mnyamangeni from CCBRT.
Karibu.
My question goes to Dr. Atasha. Wonderful presentation. Could you share with us some common risks associated with nuclear scanning?
Thank you so much for that question. The common risks that are associated with nuclear medicine scans are when we introduce the radionuclide or a tracer into the body, and the most common risk or side effect is a hypersensitivity reaction. But we are also capable of handling any side effect that may arise during when a patient is going through a scan. So what we do is when a patient deserves or needs a scan, that patient is actually sits one-on-one with their nuclear medicine technologist before the scan, where the patient's thorough history is taken, all allergies are considered, all objects that are in the body, foreign or non-foreign, are considered, so that they are cleared for safety before the scan is performed. In case or during the scan there is a sensitivity reaction, this nuclear medicine is actually in between the cardiology department and the oncology department that is very well facilitated, and the emergency department, to handle any side effect whatsoever. After the scan, the patient is always monitored before they are sent home, and they are also followed up the next day to check on how they're going. And that is how we ensure the safety of all our patients. Thank you. Also, just to add up on this, today from 1 p.m. to 4 p.m. onwards at the Aga Khan Hospital booth, which is on your right when you enter, there is a nuclear medicine technologist who will be seated to answer any questions on all of the scans that I have mentioned, take bookings, and make sure that if a scan is needed, it is done as efficiently and as smoothly as possible.
Thank you, Dr. Alicia. Maybe we don't have time to carry on this program. I can invite one last question. One last question, please. Yeah, okay. There's a microphone, yeah.
I have a question. I don't have anybody in mind, so anyone who wants to answer. My name is Kwesi Buahine. I'm from Ghana. It's very impressive what you're doing, and sitting here and listening, I feel like you are setting standards. So my question is, how do you ensure and maintain standards? What is your benchmark for what you do? How do you know that you are on top?
My request to, the question should be answered by my CEO, so he's just sitting next behind. My consultant has been doing a very tough presentation, so please. So if you can assist, yeah.
Maybe I'll start saying that I think I agree with you. As a nation, we have to start somewhere. And if you start a journey, don't expect that you'll go fast and reach there. You have to go slowly. In terms of standards, I think every medical professional who's underwent very well-structured training, he knows about what we call standards and the quality. I think through your training, you get empowered from your medical school, from your nature, how you are mentored. That also is a benchmark. before if you go to the institution quality standardized care. I'll talk about on cardiology. I think cardiology is one of the fields which is moving very fast compared to other specialties in terms of technology. And there is a lot of regulation because otherwise you have to have abuse. We have a lot of societies, also they maintain that, and we think we are part of this. And if you look on all this specialty in Aga Khan, all of us, we are members of those societies. We practice according to world standard and the guideline which is acceptable in the world. Probably we might be moving more further from the national level. I think if you know that the transition of burden of disease now worldwide, especially the third world countries, we are moving from infectious diseases going to non-communicable diseases. And also this is going to impact in all our practice. Whether you are an infectious, you will see all this kind of problem. I think the benchmark and the quality and what we are doing is going to depend also on your training. Aga Khan is setting a standard. There is already university which is setting on the quality of the graduates, which are going to follow what is available at the international level. I think this could be a benchmark. If I come to institution now, I think I'll leave this to the CEO to explain, which there is also another way. The institution is working to make sure that Aga Khan is offering a world standard, high quality care.
A few comments, Mrs.
Thank you. So, well, I'll just add on what have been said. Well, maintaining standards is not an easy job, but it's a doable one. So we at Aga Khan, of course, with our Joint Commission International Standards, we have some protocols that we follow, and we ensure each department has their own KPIs that we usually make a follow-up on them with the heads of departments and with the team that they are followed well. However, it's a little bit of a work that has to be done to ensure everything is done correctly. So speaking as a doctor, you don't need the guidelines to follow to ensure that your work is good. You just need to work. So I think we at our institution, we work so hard and we ensure that things are done perfectly so that to ensure a very good outcome. So that's all what I can say for now. Thank you.
Thank you, Dr. Fatma Bakian. You want to add up something, Dr. Dibai, just for 1 minute, please? Okay.
So we also have the opportunity to collaborate with sister institutions and also some global institutions as well. We have registries, okay, and on these registries there are benchmarks, okay, which you must meet, depending on which disease condition you are talking about, okay? Cancer registry, heart attack registry, stroke registries. For example, we have an East African neuroscience community, okay, that also have their benchmark for stroke care, okay? And these are global benchmarks. So, and every month we meet to be sure that each sister institution is actually meeting up with this standard that is set. So we have benchmarks.
Dr. Alicia, JSAID, AHA.
To add up to that, all doctors around Tanzania who are working at the satellite Aga Khan hospitals have access to the doctors working in the main hospital to via virtual consultations and teleconsultations as well. Just for oncology, we have East African multidisciplinary tumor boards, where we discuss cases with each other around the country to make sure that whatever diagnosis and the treatment is getting is world-class and universally acceptable. And one thing that we are all proud of here is that we are the only hospital that is JCIA accredited, which is the Joint Commission International Accreditation. And this year, again, we won that with a gold standard. And that is how the institution makes sure, apart from training, doctors, workshops, campaigns, is that we maintain the level of best practices.
Thank you. And that brings us to the end of this session. I pointed out AHA because I know that Aga Khan is one of an international training center for American Heart Association. We do training for BLS, ACLS, and PULSE, and this is what I also wanted to point it out. Now, time is not in our favor. I see my organizers are yes, leaving us. We leave this room for now, but we need to really appreciate the audience who has been here since we started, and also like to appreciate our doctors for the great presentation, and of course the leadership of the Aga Khan Health Service Tanzania. Asanteni sana, karibuni.
Thank you so much. Thank you so much. We still have another sessions going on in this room. There is a who is who in healthcare. Also, we'll have another presentation from NMB. NMB will be a very short one, so we start with NMB first. So NMB, please get prepared just for 10 minutes to present. Then who is who, get ready. Everyone, sorry for the inconveniences. We will start with who is who, then NB will follow. That is according to the information that I got. So we are going to start with who is who.
Security,